Let's shift our focus to the latest updates from the ongoing COVID crisis in North Korea. North Korean military medics have now stepped up measures to expand the distribution of medicines across the country to help ease the virus outbreak. Now, this comes a day after North Korea's Supremo, Jong-Un, ordered the military to stabilize the distribution of COVID medicines in the country. According to the North State Media Agency, military has now deployed its medics to pharmacies in Pyongyang city to start a 24-hour supply service of medicines. Jong-Un, meanwhile, has also imposed a nationwide lockdown to try and slow the spread of the disease. Authorities have reported more than 1.48 million cases of fever as of Monday evening. Nearly 60 people have died so far, including 6 fatalities that were reported in the last 24 hours alone. Authorities, however, have not confirmed how many among the suspected cases are COVID positive. Now, this comes just days after North Korea confirmed the country's first COVID outbreak. Pyongyang acknowledged last week that the country is currently witnessing a massive surge in COVID cases. Experts have raised questions that such an explosive outbreak can devastate the country, which is currently lacking proper medical supplies and a strict vaccine program. South Korea, meanwhile, is offered to help North combat the crisis. South Korean President Yoon on Monday said that he would provide full support to North Korea in tackling the COVID surge if Pyongyang responds to the offer.
우리는 코로나 바이러스의 위협에 노출된 북한 주민에게 필요한 지원을 아끼지 않아야 합니다. 저는 인도적 지원에 대해서는 남북 관계의 정치, 군사적 고려 없이 언제든 열어놓겠다는 뜻을 여러 차례 밝혀왔습니다. 북한 당국이 호응한다면 코로나 백신을 포함한 의약품, 의료기구, 보건 인력 등 필요한 지원을 아끼지 않겠습니다.
And now for more on this, joining us live on this broadcast is our correspondent Phoebe Amoroso from Tokyo. Phoebe, thank you for joining us. Now, Phoebe, my first question to you, there are of course concerns over how the nation will deal with an outbreak of this scale. This as there is lack of proper medical infrastructure and a vaccine program. What do we know about this so far?
That is a huge concern because even before this outbreak of COVID-19 in North Korea, the country is believed to have one of the worst healthcare systems in the world. It lacks basic medical supplies, there's a lack of intensive care units, and it has turned down help with vaccinations for COVID-19. It refused them through the COVAX program. It's also turned down Sinovac vaccines from China. So it does not have any specific medication to treat this. It's believed that they are recommending that people take fever reducers and painkillers and also antibiotics. These do not tackle the virus directly, but they can be used for secondary infections that can occur. But this is far from adequate. There's also much talk about the use of traditional medicines. People are being told to gargle salt and drink certain kinds of tea. But this is believed to be, well, this will definitely be far short of what is needed in terms of the right medical supplies. And indeed, health experts are saying that the most important thing in terms of aid to North Korea at this time is to get antivirals into the country. But it has so far not responded to, for example, South Korea's offer of medical supplies.
Absolutely. Now, also, is there any clarity on what is driving this outbreak in North Korea?
It's very hard to get exact details, but state media reported that the spread began in late April, and indeed mid-April there were 2 mass gatherings for national events held in the capital Pyongyang, and the outbreak has been traced to Pyongyang, the capital, and that's where the resources and a lot of the military who have been ordered to oversee the distribution of medicines have been concentrated. But it's not clear exactly how it is spreading. However, North Korea's economy is dependent on the movement of people. So that's been a big concern as how to keep production and construction still operating to allow the economy to still continue on a certain level. The state media have reported that they're looking to isolate work units to make sure that there isn't spread between those units, but there is a concern as to how much the workers can be isolated and whether this will then have a knock-on effect on agriculture. The country is already suffering from food shortages, and if the agriculture can't continue, that's also a big concern that can also lead to the disaster escalating further.
Absolutely. Well, Phoebe, thank you so much for bringing us all the latest on this. WION is now available in your country. Download the app now. Get all the news on the move.